there, I'm Dr. Kim Langdon, and I'm with CCM Health, and today we're going to do an educational video about strokes. We'll talk about what causes them, the different types of them, how we diagnose them, and then how we treat them and manage the condition. So with that, I'll get started. Let's talk about stroke. So what is a stroke? Well, it's basically a brain attack. Like a heart attack is when you get less oxygen to the heart. Well, a stroke is when you get less oxygen to the brain. Any part of the brain could get cut off, but it's definitely because of a lack of oxygen, either because of a blockage or because of a burst blood vessel or something that causes a hemorrhage. So you can have temporary or permanent problems with strokes. If it's a minor stroke or not a major stroke, then you might just have some temporary weakness in an arm or leg or a drooping face. However, you can become permanently paralyzed on one side of your body or have trouble speaking. And it's estimated that about 66% of all survivors will have some type of disability. So every year, 800,000 people experience a new or repeat stroke. Strokes happen every 40 seconds. It's the fifth leading cause of death in the US. And fortunately, 80% of strokes can be prevented. But unfortunately, if that doesn't happen, then it is one of the leading causes of adult disability in the United States. So here's some pictures that show what types of stroke there are. There's an ischemic stroke, which is from clots that block the artery. And if the artery is blocked, that means oxygen can't get passed into the tissue. There's hemorrhagic strokes or bleeding strokes. There's transient ischemic attacks, which aren't true strokes, but are very suggestive of a stroke that could come on shortly. So it is not to be ignored. Cryptogenic stroke, brainstem stroke, and silent stroke we'll discuss in more detail. So as you can see from the picture, ischemia means lack of oxygen. So that occurs when the vessel supplying the brain is obstructed, and accounts for most 87% of the strokes. And it's usually caused by a blood clot that originates maybe from a irregular heartbeat in the heart, or something that would arise in your neck arteries. Hemorrhagic stroke, that means that a blood vessel has burst for whatever reason. Usually that's an aneurysm or some sort of weakening of the vessel, or an AV malformation, meaning an arteriovenous malformation, where the arteries and veins connect directly. There's two types of hemorrhagic strokes: intracerebral, which means within the brain tissue, and subarachnoid means outside of the brain, but under the skull, so that it can still compress portions of the brain and cause problems. And as I mentioned, an aneurysm is an abnormal we'll get to that in a minute because there's a picture coming down on one of these slides. But let's talk about a TIA. They're a transient ischemic attack, sometimes called mini strokes. It's a temporary blockage, but it can lead to a full blown stroke. So it's not to be ignored. When you get any sort of symptoms, visual symptoms or slurred speech, you need to call 911 immediately and contact your practitioner. So warning signs. Warning strokes are often followed by more severe strokes. About 1/3 of the people who have a TIA go on to have a severe stroke within a year. So one way you can remember some of the warning signs of a stroke is by the acronym FAST. F standing for face drooping, A for arm weakness, S for slurred speech, and T means time to call 911. Other things would be weakness or numbness on one side of your body, slurred speech, blindness in one or both eyes, dizziness, or a severe headache that comes on suddenly. A cryptogenic stroke is a stroke of unknown cause. We usually figure out what causes it, but sometimes we just don't know. Then there's brainstem strokes, where they're difficult to diagnose because the brainstem is deep in the back part of the brain. The symptoms of a brainstem stroke would be things like nausea, dizziness, vertigo, not being able to stand steady, Because the brainstem's so small, it's hard to diagnose, but it's also an essential part of our brain because it monitors things like consciousness, blood pressure, breathing, and all our motor control flows through the brainstem. So a brainstem stroke is, of course, very serious. So what are some of your risk factors for having a stroke? Well, lifestyle would be things like being overweight, obese, lack of activity, heavy or binge drinking, use of drugs such as cocaine and methamphetamines. Medical risk factors would be blood pressure elevation, hypertension, cigarette smoking, high cholesterol, diabetes, sleep apnea, other types of cardiovascular disease, such as heart failure, heart attacks, or an abnormal rhythm, and then a personal history or a family history of stroke or cardiovascular disease or other risk factors. People older than 55 are more likely to have a stroke than younger people. African Americans have a higher risk of stroke than other ethnicities. Men are at higher risk of stroke than women. Women tend to be older, but they are more likely to die of the stroke. And hormones and birth control pills or other hormone therapies may be associated with stroke, such as at times when you're pregnant and having a child. So what are the signs and symptoms of a stroke? Well, you might present with things like you're just confused or you're extremely sleepy. You might feel weak or have paralysis on half of your body. You might have numbness on the one side of the body, partial vision loss, double vision, not speaking right, or difficulty with balance or feeling dizzy or vertigo. So here's the acronym again. As you can see, this lady's face is drooping on one side. And, you might see that somebody drops something unexpectedly. That could be a sign of the arm weakness, or they're slurring their speech. And so again, that's time to call 911. So here it is in just more detail. It could be something as simple as just not being able to get words out correctly. So you can ask them to repeat a simple sentence to see if they can do that. You can ask the person to smile and see whether one side goes up and the other doesn't. Ask them to raise both arms. But in any case, if there's any suspicion, you should call 911. So what are the complications of a stroke? Well, paralysis or loss of muscle movement. You might have difficulty talking or swallowing. As you can see, if you can't talk clearly, it's called dysarthria. Difficulty swallowing is called dysphagia. You might have difficulty with language called aphasia. You might have memory loss or just having trouble thinking things through, such as making judgments or reasoning and understanding concepts. And you could have difficulty controlling your emotions, and you are prone to depression if you have a stroke. You might develop something called central stroke pain or central pain syndrome. And this is when you become very sensitive to temperature changes, especially cold. So those are very hard to treat because the problem's originating in your brain. It's not due to a physical injury of the area that you're having the pain. You might have changes in behavior, not able to care for yourself, such as grooming or your daily chores. So here's that picture I was talking about over here on the right. That's a picture of an aneurysm. That can be picked up with a cerebral angiogram where they inject dye into the arterial system to see if they can outline any abnormal dilations or connections between the arteries and veins. So a CAT scan is, of course, used for almost anything related to the brain. Physical exam and blood test to look for, different things like clotting time. So a CT scan of the head can detect things like a hemorrhage, a tumor, or a blockage in a blood vessel and some other conditions. It can be combined with angiography so that we can see the inside of the vessels and the contour. There's also the magnetic resonance imaging, MRI, can also detect ischemic strokes and brain hemorrhages. And it's an MRI is just powerful radio waves combined with magnets so that we can visualize this on a high resolution screen. You might have a carotid ultrasound. Carotid arteries are your neck arteries. And so ultrasounds can be run over those to see if you have any blockage or show any buildup of fatty deposits. Again, an angiogram, it's cerebral, it's a little flexible tube is inserted into one of your groin vessels, and it is sent to the brain so it can inject dye so we can see the anatomy, contour, shape, and size of the vessels. And then echocardiograms are basically ultrasounds of the heart, so we can get detailed images of, see if there's any source of clots in your heart, arising from your heart, going to your brain. And it's also called a transesophageal echocardiogram. So the mainstay of treatment is medication. Usually if you get to the hospital fast and you get diagnosed with a clot in your brain, because that's the most common, you would be given intravenous tissue plasminogen activator, or TPA. It's most effective if it's used with it before 3 hours or up, but it can be effective up to 4.5 hours after the onset of symptoms. And it helps dissolve the clot. There's also emergency endovascular procedures, such as removing a clot with a stent retriever. They basically maneuver a little device in there so that it can grab and trap the clot and pull it out of the vessel. And depending on where the clot is, you might undergo this endovascular therapy, because it improves the outcomes and reduces the long-term disability after ischemic stroke. Other procedures are carotid endarterectomy. So that's when the doctor cuts into the arteries and actually removes the plaques from them. The carotid arteries, again, are in your neck that supply your brain. They might they either stitch back up the artery or put a little artificial graft there to repair once they cut into it. Does have risks, but your doctor will advise you accordingly. Then there's angioplasty and stents, as we discussed. We can go in there and put a stent in there. By basically, the stent goes in, a balloon is expanded, that opens the vessel, and so that the blood can travel more freely throughout your brain and so forth. So here's a picture on the left side of the little clot remover. You can see the clot, it kind of gets all tangled in that wire and then it's pulled out. And then a more graphic picture of where the incision in your neck would be if they actually cut into your artery. So as far as a hemorrhagic stroke, so again, that's where there's not a blockage, but there's been a leakage of blood into your brain rather than staying in the blood vessel, such as an aneurysm or an AV malformation. So in those cases, surgery is more likely warranted. So they will go and surgically clip the abnormality at the base of the aneurysm. They might put a coil in there. And they guide it through a groin artery and use X-ray imaging to get it to the place that it needs to be. And the coils then fill up this extra space so that the blood can't travel and flow through there abnormally, or put too much pressure on the walls that causes it to burst. And then if you have an AV malformation, you might just have it surgically removed if it's accessible. And then stereotactic radiosurgery is just using highly focused beams of radiation, so it shrinks the abnormality. Anticoagulants are the mainstay. There's different types of anticoagulants depending on where they are interacting in the cascade of the clotting cascade. They're often used to prevent to manage existing blood clots. Sometimes people get clots in their legs, so they'll be put on an anticoagulant. Sometimes if you have irregular heartbeats, like atrial fibrillation, you'll be put on an anticoagulant just to prevent the possibility of a clot traveling to your brain. So they're used in a lot of different cases, but obviously they're used for clots in the brain. So we go down, and the first types are vitamin K antagonists, because vitamin K is important for the clotting mechanism. So if you can antagonize that process, you can, reverse the clotting process. These are just a list: warfarin and Coumadin. Warfarin's the most common. The other ones, not as important. Heparins. Here's a list of the different types of heparins. There's low molecular weight heparin. There's high molecular weight. They have different advantages depending on what your condition is. Then there are the thrombin inhibitors. They're show bivalent, meaning they have two components versus one component. Then there's direct factor XA inhibitors, some of the newer clotting drug or anticoagulant drugs. Okay, so Coumadin or warfarin is an anticoagulant blood thinner that reduces the formation of clots. There's always a risk of bleeding with Coumadin or any anticoagulant, and you should always consult your doctor if you have any unusual signs or symptoms. If you miss a dose, go ahead and take it when you remember. But if it's too close to your next dose, don't take 2 doses at once and tell your doctor. And if you think you've taken too much, definitely call the poison helpline, and avoid making any changes to your diet without talking to your doctor first, because there are some herbs and things that can interfere with your anticoagulant. Side effects, the side effects are bleeding. So any place in your body can bleed if you have too much Coumadin or warfarin involved. So you can see you might get bleeding gums, heavy menstrual periods, blood in your urine, coughing up blood. So you need to let your doctor know about those. How do we measure how much, anticoagulant you have in your system? Well, it's called an INR. You don't really need to know what that stands for, but it measures the prothrombin time, because obviously we want to slow down the clotting time, right? So if we can prolong the clotting time, then we can make sure you don't form a clot. So in healthy people without any underlying conditions would just have an INR of 1.1. But when we put you on an anticoagulant, we want to get the INR in a range of 2 to 3. And that's considered the therapeutic range. There are other drugs that will affect Coumadin, simple things like supplements, vitamin K. So please don't take any supplements without discussing it with your doctor. It also can interact with simple things like ibuprofen, again, because ibuprofen impairs platelet aggregation. So you would have 2 potential risk of excess bleeding if you took it. So avoid ibuprofen and talk to your doctor about appropriate substitutes. Probably Tylenol would be your best choice. There's other conditions that interact with Coumadin, such as diabetes, hypertension, protein C deficiency, kidney disease, but your doctor will assess that before putting you on it. Then there's the XA, it's 10A factor inhibitors, because 10, there's all different numbers of clotting factors. So this particular one is 10, the Roman numeral 10, and it selectively, reversibly blocks the activity of clotting factor XA. So it's good for preventing and clots and for treating existing clots. There's a list down there below. You might be on one of them. Again, if you're actively bleeding or too thin or have other problems, other bleeding conditions, you can't take this. So your doctor will know what to advise you of. Another thing can happen if you take these 10A inhibitors, especially if you have an epidural. So of course, all your doctors and healthcare providers will know about this and advise you accordingly. Of course, you should tell your doctor about all your other medical conditions, whether you're allergic to latex. Your medical history is very important before you start any medication. This is a list in alphabetical order of all the potential side effects. Again, if anything changes, then it could be a side effect of the drug you're on. So any change in your symptoms, signs, or seeing blood in any area, urine, stool, coughing it up, needs to be told to your doctor. So the 2 that they talk about here are Rextra and apixaban. And as you can see, there's disease interactions with both of them, something your doctor will take into account. Then we have another type called edoxaban, and then betrixaban here again just talks about what it interacts with as far as drugs are concerned, and then what diseases it will interact with for both of those types of drugs. Heparin is an injectable anticoagulant and it affects antithrombin 3. As I mentioned, there's high molecular weight and low molecular weight heparins. If you take the low molecular weight, you have to have more frequent monitoring of your INR and your coagulant status, whereas and heparin can prevent clots in the arteries and the veins, as well as treat clots in those two types of vessels. Again, what's true of one anticoagulant is basically true of another as far as what the side effects are. As you can see, there's a lot of overlap here. Now, these two types, the reason they have the X's here and the D's here, that's a pharmaceutical category description of what category these are in. So if it has an X by its name, it basically means you have to avoid the combination of fragment with all those listed beneath there. And if there's a D, then you might need a therapy modification. So as you can see, even simple things like licorice could become a problem. So make sure you let your doctor know and read about the drugs you're on very carefully so you understand as much as you can. Fragment interferes with, as you can see, if you had hemophilia, you wouldn't want to be on that, or you had active bleeding. So again, your doctor will know which drugs are most appropriate given your underlying medical conditions. Thrombin inhibitors are also anticoagulants. They inhibit the activity of thrombin, so they prevent blood clot formation. And they also inactivate free thrombin and any thrombin that's bound to fibrin. So they can prevent arterial and venous blood clots or thrombosis. These are some of the side effects in alphabetical order, pretty much so. Mostly bleeding and other unusual symptoms that might be a response to bleeding. So here we go, some clinically significant avoid combinations. What they tell this Angiomax, obviously you wouldn't take it with Coumadin, whereas you look over here at Pradaxa, it might be a problem if you have active bleeding. And anybody with active bleeding, these would be contraindicated. But again, you just need to talk to your doctor and keep them informed of any unusual signs or symptoms. That concludes our discussion on stroke. You can visit these presentations on our website or on social media. We have a whole list of educational topics for your review. And I really enjoyed talking to you today. This is Dr. Kim Langdon with CCM Health, and I look forward to future discussions. Have a great day.